High blood pressure is a common condition that affects the body's arteries. It's also called hypertension. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. What causes high blood pressure? High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, such as not getting enough regular physical activity. Certain health conditions, such as diabetes and having obesity, can also increase the risk for developing high blood pressure. High blood pressure can also happen during pregnancy. Symptoms of high blood pressure. One of the most dangerous things about hypertension or high blood pressure is that you may not know you have it. In fact, nearly 1/3 of people who have high blood pressure don't know it. That's because high blood pressure doesn't have any symptoms unless it's very severe. The best way to know if your blood pressure is high is through regular checkups. You can also monitor blood pressure at home. This is especially important if you have a close relative who has high blood pressure. If your blood pressure is extremely high, there may be certain symptoms to look out for, including severe headache, nosebleed, fatigue or confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, pounding in your chest, neck, or ears. People sometimes feel that other symptoms may be related to high blood pressure, but they may not be. Dizziness, nervousness, sweating, trouble sleeping, facial flushing, blood spots in eyes. Treatment. High blood pressure treatment typically involves a combination of medication and lifestyle changes to help you manage the condition and prevent or delay related health problems. The goal is to get your blood pressure below the high range. Here are the most effective ways to lower your blood pressure levels. 1. Lifestyle changes. Cut your salt intake to less than 6 grams a day, which is about a teaspoonful. Find out how you can reduce the amount of salt in your diet. Eat a low-fat, balanced diet, including plenty of fresh fruit and vegetables. Get tips when eating more healthily. 2. Increase activity and exercise more. Aerobic and resistance exercise can significantly lower blood pressure, especially for men, but you don't have to run marathons. Increasing your activity level can be as simple as using the stairs, walking instead of driving, doing household chores, gardening, and going for a bike. 3. Lose weight. Find out what your ideal weight is using the Healthy Weight Calculator and read advice about losing weight if you're overweight. 4. Cut back on sugar and refined carbohydrates. 5. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. 6. Eat less processed food. Most of the extra salt in your diet comes from processed foods and foods from restaurants, not your salt shaker at home. Popular high-salt items include deli meats, canned soup, pizza, chips, other processed snacks. 7. Stop smoking. It can be difficult to do, but it's worth it. Stopping smoking just good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. 8. Reduce stress. Finding ways to reduce your own stress is important for your health and your blood pressure. 9. Try meditation or yoga. Mindfulness and meditation, including transcendental meditation, have long been used and studied as methods to reduce stress. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. 10. Eat some dark chocolate. Dark chocolate has been shown to lower blood pressure, but it should be 60 to 70% cacao. A review of studies on dark chocolate has found that eating 1 to 2 squares of dark chocolate per day may help lower the risk of heart disease by lowering blood pressure and inflammation. 11. Try medicinal herbs. Herbal medicines have long been used in many cultures to treat a variety of ailments. However, you should always check with your doctor or pharmacist before taking herbal supplements. They may interfere with your prescription medications. 12. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. 13. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. A meta-analysis found that for people with high blood pressure, garlic supplements reduce their systolic blood pressure by up to about 5 mm Hg and reduce their diastolic blood pressure as much as 2.5 mm Hg. 14. Eat healthy, high-protein foods. Study concluded that people who ate more protein had a lower risk of high blood pressure. For those who ate an average of 100 grams of protein per day, there was a 40% lower risk of having high blood pressure than those on a low-protein diet. 15. Take these BP-lowering supplements. These supplements are readily available and have demonstrated promise for lowering blood pressure. Omega-3 polyunsaturated fatty acid, whey protein, magnesium, citrulline. 16. Drink less alcohol. Alcohol can raise your blood pressure, even if you're healthy. 17. Take prescription medication. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs. If your high blood pressure continues, be sure to consult a doctor who can prescribe the appropriate medication.